Hello, welcome to my channel at Dr. Physiotherapist. Hope you all are doing well. So, today our topic is what is spina bifida? Spina bifida is a congenital disorder due to the incomplete closing of the embryonic neural tube. Some vertebrae overlying the spinal cord are not fully formed and remain unfused and open, as you are watching in a picture. If the opening is large enough, this allows a portion of the spinal cord to protrude out through the opening in the bones. If we move towards the causes, first cause is increased body temperature. There may be a rise during the first new weeks of pregnancy due to hypothermia. Spina bifida has been linked to slight increase in core body temperature caused by fever or use of sauna bath. Then we have the family history. One child with a brain tube imperfection have somewhat higher possibility having one more child with similar deformity. Ladies who were born with a brain tube deformity have a more noteworthy possibility bringing forth a kid with spina bifida than somebody who doesn't have a neural tube imperfection. Third cause is maternal diabetes. Now we have certain medications such as some anticonvulsants. Pregnant women taking valproic acid have an increased risk of having child with spina bifida. Folate deficiency. The natural form of vitamin B9 is called folate and is important for the proper development of a healthy baby. Synthetic form found in supplements and fortified food like beans and legumes and is called folic acid. Now, if we discuss the embryology, then we should know that under normal circumstances, the closure of the neural tube occurs around the 23rd, that is rostral closure, and 27th, that is caudal closure day after fertilization. Spina bifida is caused by the failure of the neural tube to close during the first month of embryonic development, often before the mother knows she is pregnant. Spina bifida malformation fall into three categories. First is spina bifida occulta, second is spina bifida cystica with meningocele, third is spina bifida cystica with myelomeningocele. Spina bifida occulta is the mildest form of spina bifida. Occulta is Latin for what hidden. There is a small cap in the spine but no opening or sac at the back. The skin at the site of lesion may be normal, or maybe there is some hair tuft. There may be a dimple in the skin or birthmark, no hydrocephalus and no bladder and bowel involvement. Spina bifida cystica with meningocele is the least common form of spina bifida. It has meningeal cyst on the back. Vertebrae develop normally, but the meninges are forced into the gaps between the vertebrae. Spina bifida cystica with myelomeningocele is the most severe complications. Unfused portion of the spinal column allows the spinal cord to protrude through an opening. Meningeal membranes that covering spinal cord form a sac enclosing the spinal elements. The diagnosis involves the detection during pregnancy by testing the mother's blood, that is alpha-fetoprotein AFP screening, or a detailed fetal ultrasound. Increased level of maternal serum alpha-fetoprotein should be followed up by two tests: an ultrasound of fetal spine and amniocentesis of mother's amniotic fluid. Now, if we discuss the physiotherapy treatment, then we have variety of exercises. First is strengthening exercises. The first type of strengthening exercise is leg presses. This exercise involves pushing against or resistance with the leg while seated. It targets quads, hams, and glutes. Now we have another exercise, that is sit to stand. These exercises involve standing up from a seated position, which helps to strengthen the legs, hips, and core muscles. Hip bridges. These involve lying on the back with knee bent and lifting the hip off the ground. It targets the glutes and hams muscles. Now we have a seated row. It involves pulling a resistance towards the body while seated, targeted the back, shoulder, and arms. Standing on a calf involves standing on the toes to target calf muscles. Stretching exercises may be recommended, which involve stretching of flexors, hip flexors, hams, and calf muscles, but recommendation based upon the physiotherapist's advice. Balance training can be beneficial for individuals with spina bifida as it helps to improve overall stability and coordination, and in turn lead to increased mobility. Specific balance training recommended will depend on the individual level of function and severity of their disease. Balance training involves single leg balance, heel to toe walking, standing on wobble board, additionally exercise that incorporate eye movement and head turn. It is important to perform balance training under guidance of physical therapists to avoid further injury. Assistive device PT can recommend and fit individual with spina bifida with assistive device such as braces, crutches, or wheelchairs to improve mobility. Ankle foot orthosis with or without external aid used when lower lumbar level of lesion, power 5 quadriceps and 4 of medial hams. Early walking is better than wheelchair in children with high level of lesion spina bifida. 2 orthosis to maintain reciprocal gait pattern, reciprocating gait orthosis and hip guiding orthosis. Prerequisites of fitting orthosis: no more than 20 degrees of hip flexion, knee and foot can be rendered in plantar grade position. Hope you like our video. Thank you very much. Do like, subscribe and share and comment below in the comment section.